what y'all don't have nothing to deal with because y'all in nursing school.
Stress.
See? Stress. Y'all don't even know what stress is.
Never heard of it.
You never heard of it. What? That's what I'm talking about.
On radio all the time.
It's
a regular.
All right. Chapter 43, stress. Chanel, what is that stress or distress?
It's a condition in which the human system responds to change in its normal balanced state.
Yeah. Now, if I am experiencing stress, is that a medical emergency?
It depends if you like go into you start hyperventilating.
But if I'm not hyperventilating?
Depends on how long you've been stressed.
Okay. For 2 minutes.
No.
No.
Chill.
I mean, jeez, it could be an emergency for me, you know? Yes, Francesca.
Stress cause high blood pressure, which can eventually cause a heart attack.
Yes, they can, especially if you experience it for an extended period of time. Now, stress, again, in and of itself, it's a normal part of life. It's not because you're in nursing school that's why you've been introduced to stress for the first time in your life.
That's just why I'm distressed.
That's why you're distressed? Damn. Okay, what were you saying, Carlos?
I haven't been distressed ever.
Whoa.
Must be nice.
See, Carlos got it made. You see?
He does.
All right. And we're going to address what you just said, what you talked about, Francesca, in terms of the physiological effect of stress. Now, when it comes to stress or stressors, you must know the different types of stressors. There are chemical agents, physical agents, infectious agents, hypoxia, etc. Chemical agents. What's an example, Cornelius, of a chemical agent being a stressor? An example. I think your book gives several.
Chemical drugs or poisons.
There you
Oh
go.
yeah.
Page 1766 under physiological stress.
Okay. Drugs. Okay. Any type of drugs, right? Whether prescription drugs or non-prescription drugs can be a chemically induced stress. Okay. What about physical agents? Heat. If we in Florida, the temperature is like 110 degrees. Okay. Could have a heat stroke, for example, okay? Infectious agents, you already know, like the bugs, for example. So you must know the different types of stressors. Just like how earlier it was mentioned, you got to know the different types of pathogens, so you know what to do, how to effectively care for the client. The same thing with regards to stressors. You need to know what is causing the client to have a negative physiologic reaction, okay? Hypoxia, for example, because once we know the cause or the culprit, now this will help us to provide a better treatment plan. So examples of psychosocial comes to balance or homeostasis, not hemostasis, I think it's called. Don't confuse the two. There's homeostasis, balance, and hemo, which is basically blood standing in one place. Okay, so make sure you read carefully. All right.
Never seen that there was no sound.
I'm just saying. Okay. There's two different types of stresses. You have the local adaptation syndrome, and then you have general adaptation syndrome. Now, I do not care who came up with it. I ain't testing you on that. But I do need you to know the difference between local and general adaptation syndrome. LAS is when it involves only one specific body part. So, let's say I hit my arm right here, and it hurts. That's the only portion that is affected. That is an example of local adaptation syndrome, or like a reflex pain, or you notice maybe I cut myself and then there's a inflammation. Again, that's local adaptation syndrome. With regards to GAS or general adaptation syndrome, this is where you see the entire body or most of the body is not impacted, okay, or having a reaction, and it goes in stages. This stage. Okay, so there's a threat, And the threat can be practically anything. A pathogen of sort, maybe a motor vehicle accident or something, okay? But there's a threat of sort. And that threat now causes an alarm reaction, which then leads to different activities. So you notice that physiologically the heart rate goes up, blood pressure goes up, the glucose levels goes up, metabolism starts to go up, okay? Now you notice at this point, this is where the person enters what's called, or what you notice, or what you should have heard of, fight or flight response, okay, at this point, all right? After that, then there is the stage of resistance, okay? With regards to the stage of resistance, you see at different activities starts to, well, I take that back, not different activities, but specific activities, specifically neuroendocrine activity, starts to return to normal, okay? You see where now the coping mechanism starts to take place at the stage of resistance. You try to go back to baseline as much as feasibly possible. Now, I need you to understand, one of two things can happen after the stage of resistance takes place. Remember, at the stage of resistance, this is where the body is trying to go back to baseline as possible in terms of physiologic adaptation. You see now, either the body recovers and we are happy, you're healed, etc., or the body continues to fight where it goes into a stage of exhaustion. At the stage of exhaustion, this is where you notice where now the blood pressure, because the body has been fighting so much, and now it's tired, so to speak, you see the blood pressure goes down, but the heart rate continues to elevate. You can also notice respirations are also elevated as well, and the patient, the client, or the body, okay, physiologically is tired. After the stage of exhaustion, one of two things could happen. Either now they either rest and recover, which is what we would hope for, or the patient becomes unalived. Okay, they end up 6 feet under. All right. Oh, okay. So that's what happens. Okay, you must know the difference between LAS and GAS or gas, and I see that y'all talked about it already in Paco, right? Yeah. So y'all definitely don't play with me, okay? So you must know the timing when it comes to, especially whether it be local adaptation syndrome or general adaptation syndrome, you have to pay attention to the timing. At what point is the client in terms of stages? Okay, because your care or the care you're going to provide is going to be different at each point. The care you're going to provide at the stage of resistance is definitely not the care you're going to provide when the patient is unalive. Yeah. You understand? So pay attention to the scenario specifically, so you know, for example, the client, the scenario might say the patient was, had an infection of sort. Blood pressure is 190 over 100. Heart rate is Heart rate is 110. What is the care plan now? What is the appropriate nursing intervention at this point? Well, they're still probably at the alarm reaction phase, so the care is going to be different. We probably might, give medications to lower the blood pressure, for example. Does that make sense? Okay, so pay attention to the stages so that you know how your care plan is going, or your interventions is going to be according to what stage the client is in. Does that make sense?
Yes.
Okay. All right. Boom. So alarm reaction again. This is what I basically was talking about earlier. So you see the hormone levels are rising, and the patient could also, in addition to what I said earlier, they could also enter shock and counter shock phases. Okay, at the alarm reaction.
Does that include fight or flight, shock or counter?
Yes, that's the fight or flight. Yes. Okay. Stage of resistance, again, body attempts to adapt to the stressor, vital signs try to return to normal. Again, homeostasis or adaptation. Homeostasis may either take place or it may not take place. Okay, at the stage of resistance. Stage of exhaustion, this is basically the same thing I was just talking about, and then you can see the psychological homeostasis. Now, with regards to psychological homeostasis, because I do not want any problem, psychological, on page 1769, because I don't want no problem, you will see they give different types of examples as it relates to psychological homeostasis. In other words, how is the patient mentally adapting? Okay, they either adapt either via mind-body interaction. They might have anxiety. We could look at the coping mechanisms and the defense mechanism. Let's look at this real quickly. On page 1769, so psychological homeostasis, the mind-body interaction. Okay, this is where, because of this stressor, the mind is reacting to the mind and the body is having an interaction. So they give an example, like for example, a student, not that any of this happens to any one of y'all, okay? The student is scheduled to take a final exam or an exam tomorrow. When is our next exam?
Tomorrow.
Okay. And notice, the student has to earn a passing score in order to pass the course, in order to remain in the nursing program. What happens to the student? Okay, after being awake most of the night, they can't swallow any food for breakfast, their heart rate is elevated, they have feelings of anxiety or apprehension, and they also have diarrhea. So mentally, they're anxious about the test tomorrow, and as a result of being worried about the test tomorrow, now you see the physiologic changes taking place. That's what happened, or that's an example of mind-body interaction. Stressed about one thing, and the body's responding as well. Diarrhea, elevated heart rate, etc. Okay? Do you see the mind-body interaction example? Or they give another example, which I think is also nice, where the client has the spouse that was killed in a motor vehicle accident. Now the client who was the sole breadwinner was just a working spouse. In addition to being the working spouse, is now thinking about how to care for the children, because that's not what they usually do. It was usually the other spouse or the wife that was doing it. Now the time has been coming in because he reports increasing frequency over the past 5 months, reporting weight loss, headaches, and stomach pain, because he's worried about not only does he have to take care of be the financial breadwinner, but also taking care of the child or the children. I think it was just one child in the example.
And he's grieving.
And he's grieving. That's all part of mind-body interaction. And guys, this is something I really want you to pay attention to, because even as nurses, this is a reality. Okay? Either the client or the spouse or significant other or next of kin, they're going through stress because of a sudden change. Now, and they also have to be taken care of. You might also have to take care of and look at them as well. Okay? Those are examples examples of mind-body. Okay? Reaction. Any questions on that?
No.
Okay, very good. Then there is anxiety, which you must also know. Yes, I will test you on anxiety. Okay? In some way, shape, or form. Now, notice what it says. The most common human response to stress is anxiety. So it is normal for clients to feel anxious about certain events that take place, especially when it's unexpected. That is why it is untherapeutic to tell the client or their significant other, don't worry. That is not therapeutic communication, number one. All right? Now, of course, like it says, anxiety is a vague, uneasy feeling of discomfort or dread, of course, and they may also have a feeling of fear as a response to the known threat. I want you to know, yes, the different levels or types of anxiety, because the care, again, is different according to the severity of this anxiety. You have mild anxiety. present in everyday living. Okay? It increases alertness and perceptual fields, etc. Helps with vision, for example. It can interfere with sleep, but it also helps with problem solving. So it's not that bad. Okay? In terms of physiological adaptation, especially. Okay? That's mild anxiety. Alright? With moderate anxiety, look what it says. It narrows a person's perceptual field so that the focus is on immediate concerns with inattention to other communications and detail. This is manifested by quivering voice, tremors, increased muscle tension, reports of butterflies in the stomach, and slight increase in respirations and pulse. That's what you see with moderate anxiety. Okay? So, again, they're hyper-focused or hyper-fixated on this stressor or this perceived threat. Does that make sense? Okay? With regards to moderate. Now you have severe anxiety. This creates a very narrow focus on specific details, causing all behaviors to be geared towards getting relief. The person has impaired learning ability and is easily distracted. And this is that severe anxiety. Okay? And some of the things that you'll see: emotional distress, interfering with activities of daily living. They may avoid certain situations that can cause anxiety. They have difficulty communicating. They may have increased motor activity. So sometimes you might see them doing fidgeting sometimes or whatnot. They are hyperventilating at this point, at severe anxiety. Okay, they may also have physiologic changes such as dizziness and tachycardia, nausea as well. Now, at this point, anxiety is no longer functioning as a signal for danger. This is what I want you to pay attention to, or motivation for needed change, but instead results in maladaptive behaviors. Okay? This is where you will see emotional instability taking place at this level of anxiety. Okay? Are we cool with that? We understand so far mild, moderate, and severe anxiety? Any questions? No questions?
So I see panic is here, but is panic a part of kind of anxiety?
It is part of anxiety.
And so yeah.
But it's like extreme level.
Yeah, that's like panic attack.
Yes, that's where you get panic. Okay. And notice what it says. It causes the person to lose control and experience dread and terror. This is where they feel like, and it could be for anything. Again, this is subjective to the client. They could feel anything as a source of threat. Like there are clients, you point maybe this marker top and they get
Is that where like phobias come into play? Like
it can.
People have such bad
yes,
phobias.
And this could be related to certain experiences or etc. Okay? Yeah. But notice what it says. So again, this is a distorted perception of events and loss of rational thoughts. Like everything seems, I hate to say irrational, but for lack of a better term, it's what they're saying is irrational. Okay? Manifested by difficulty communicating verbally, there's agitation, there's trembling, poor motor control, sensory changes, sweating, tachycardia, hyperventilation, dyspnea, palpitations. Y'all notice hyperventilation is in two types of anxiety, right? Hyperventilation is in severe and panic. But you got to make sure to differentiate between the two, that you see other signs and symptoms so that you know that the client is either suffering from panic attack or severe anxiety. Okay? And then there's also the choking sensation or chest pain or pressure with the panic attack. So it's like really extreme. All right? Very serious, and this is where the patient really have to be, even starting at severe anxiety.
Yeah, that's what I was confused at, because it says for severe, it says it's characterized by extreme fear of danger that's not real. So wouldn't that be more of like phobia or like fears that were developed due to trauma?
Yes, but starting at severe anxiety is when the patient is going to be closely looked at. Severe anxiety can lead to panic attack if we're not taking care of that patient. Yes, because it can cause more issues. Notice, you see, they're gonna have chest pain. They generally do not feel chest pain with severe anxiety. So now the care becomes more complex.
Okay.
So that's what I want to make sure we pay attention to. Are we cool so far? Okay. All right. And then they do go into the different anxiety disorders. All right, which include panic disorder, generalized anxiety disorders, the phobias, which is different types of fears of anything, PTSD, OCD, etc. Just know the different types of anxiety disorders. Then you have the coping mechanism. With regards to coping mechanism, like it says, anxiety is often managed without conscious thought by coping mechanisms where behaviors used to decrease stress and anxiety. So, in other words, this is how the patient is trying to deal with the threat, okay? So, there's different types of methods that the client may incorporate to deal with either the stressor or the threat. It's different for each person, right? You may find it odd, but let me tell you, it is their way of dealing with the issue. Crying, laughing. Yes, laughter is a common coping mechanism. Some people to deal with stress, like, I don't know, I didn't think for example, I'll use me as example. I didn't think I was that fearful. Some of us, I had students, when they come sit with me, the first thing they do is laugh. I'm like, what you laugh for? I'm scared of you. I'm like, me? Little on me? I didn't even do anything, okay? So that's a form of coping. Some people, to deal with the stressor or the threat, they'll go and exercise. Okay, you'll see them go run 5 miles or 10 miles, for example, or go to the gym. They'll smoke, they'll drink. All of these are different methods to, again, deal with the issue at hand or the threat at hand, all right? So that's coping mechanism. And then there's defense mechanism, again, other unconscious reactions to protect the person's self-esteem. That's basically defense mechanism. When extreme, however, the distorted reality can create an issue with relationships, and that could be relationships with either with a significant other, family members, at work, etc. And that's defense mechanism, where they just use different methods to, protect themselves and their self-esteem. Okay. All right. That's the different types of psychological homeostasis, or trying to be mentally intact, so to speak. All right. Now, pay attention to that box 43-4, effects of stress on the basic human needs. Do not play with me. That's Maslow's. Okay. So you have the physiologic needs. There you will see that some people, when they're stressed out, they have a change in appetite. Some people stress eat. Or some people just don't eat at all, and then they end up losing weight significantly, okay? Or they sleep a lot. Some people, to deal with the issues, they may not sleep at all because they're so stressed out. So you have to assess for these changes or these responses to the stressors. You have safety and security, where, again, the patient may feel threatened or nervous. Now, again, remember, with regards to basic human needs, meeting the basic human needs, they have to follow that particular order. Physiologic, then safety, love and belonging, so on and so forth, okay? So, if the patient is withdrawn and isolated, they're at that level, okay? So make sure you pay attention to box 43-4 in terms of how the body responds to stress and meeting those basic human needs, all right? Defense mechanisms.
That's the table on that's
Do not play with me.
1773.
1773.
Yeah.
This will show up in some way, shape, or form in multiple assessments. Okay, starting next week. Defense mechanisms. You have compensation, where a person attempts to overcome the perceived weakness by emphasizing a more desirable trait. So they give an example, a student who has difficulty with academics may excel in sport. They compensate one weakness for their strength. So they may be weak academically, but they're strong in sports. That's compensating. Does that make sense? Okay? You have denial, which you'll see a lot that clients will do. They'll try to deny, for example, the fact that they've been diagnosed with a life-threatening disease, for example, okay? They may refuse to acknowledge that they even have an health issue. That's denial, okay? Despite, for example, finding a lump, they might say, that's just y'all machine that's just messed up, or discombobulated. I ain't got nothing wrong with me. I was perfectly fine until I came and saw you, okay? That's a form of denial, okay? You also have displacement. Again, displacement, just see place and displace, you're just misplacing, like it says here, where a person transfers their emotional reaction from one object or person to another. They give a good example in the book. An employee who is angry with a coworker kicks the chair. Okay, so you're displacing your anger, which is probably a good idea to do instead of kicking the employee. Okay, huh?
Replacement be throw the chair at the coworker.
Okay, no, that is not displacement. That's battery. Okay. What else? So that's displacement. Again, you transferring your emotion on something else. Dissociation, where a person subconsciously protects themselves from the memories of a horrific event. Okay, so they don't recall, for example, a childhood or traumatic event. That's dissociation, where they're trying not to associate yourself with that traumatic event that took place. That's dissociation. Okay. Introjection is where a person incorporates qualities or values of another person into their own ego structure, which is important for the formation of conscious during childhood. So they give an example: an older sibling tells his preschool sister not to talk to strangers, expressing his parents' values. So in other words, think of like a role model, so to speak. Okay, somebody being a role model, they're interjecting it to that person. I don't want to say delete them, but another individual. Okay. Now, projection. This is common. A person attributes thoughts or impulses to someone else. They may deny any sexual feelings, for example, of a coworker, accusing them of sexual harassment. So the person likes this individual, but they're trying to, play it off and saying that the individual who they kind of secretly like is the one that's causing, the issue. That's an example of projection. They're projecting their thoughts, okay, and displaying it in a negative manner. Rationalize, they trying to have logic for everything that they do. Okay, they have a reason why they need to drink 10 bottles of beer a day. Okay,
Excuses.
Huh? Excuses, exactly. Okay, so they make excuses. They try to justify their behavior. In other words, right? Then you have reaction formation, which develops conscious attitudes and behavior patterns that are opposite to what they would really like to do. A married woman is attracted to her husband's best friend, but is constantly rooting. But yeah, so this is reaction formation. So because it's wrong, she just being rude to him on purpose.
Yeah, so
hopefully to protect herself and the marriage. Okay, that's just an example. Okay, then you have regression, which you see a person returns to earlier method. This example, you commonly see it in pediatric population. Let's say, for example, a toddler who was very well, or school-age child. Let me use school-age child, 5 or 6, who was potty trained, didn't have no problem. They are not hospitalized. Now they start wetting the bed all over again. That's regression. Okay.
Or sleep regression. Sleep regression.
It's just regression in general. It's just because of stress, because they're in an uncomfortable environment. That's really what it is for that particular reason. Of course, there is regression. There's repression, where a person voluntarily excludes an anxiety-producing event from conscious awareness. Father may not remember shaking his crying baby. Again, that's kind of like dissociation a little bit. Then you have sublimation. A person substitutes socially acceptable goals for one whose normal channel of expression is blocked.
How do you tell the difference between disassociation and repression?
Disassociation,
Because disassociation is
disassociation, the person
yourself, and then repression is voluntary. I guess it's repression
this
is voluntary.
You're purposely doing it. Where dissociation is it's unconsciously doing it. That's the main difference. Okay. Good catch. Yeah.
Do I get a sticker for that, or?
Okay.
I'm
I
just
guess, yeah, we'll give you a
I'm
sticker.
just
And then there is sublimation. Again, a person who is aggressive towards others may become a star football player. So a good example, let's say a person who likes, another example I should say, not a good example, because that's a good example in the book. Let's say a person who just, what's kleptomaniac mean again?
person who
They're
steals
like stealing small little things.
yeah.
Kleptomaniac,
Paper
kleptomaniac.
clips.
Pyromaniac, fire. Okay, a person who loves starting fire. Okay, they just love, for whatever, just love fire.
It's for the highest.
So instead of going out starting fire, you become a firefighter and fight fires. You understand? Or a person who loves cutting stuff. Okay, it becomes a butcher or a surgeon. You know, so you do socially acceptable acts. That's sublimation. And then of course there is undoing, a person who uses an act of communication to negate a previous act or communication. To give the example, a husband who was physically abusive to his wife may, there you go. Technically, yeah. Maybe it may bring her an expensive gift. And then this undoing, you see that in IPV, intimate partner violences. You see that a lot. Okay? All right, real quick before Dr. Sullivan come for y'all. You must know the effects of stress. We already talked about them. Just meeting the basic human needs, stress and health and illness. Again, long term, when the stress in and of itself is not a bad thing. It's when it's long term and it's left untreated, okay, that's when it has a physiological effect on the body, and it can predispose the individual to issues such as infection, for example, because it can suppress the immune system for long-term stress, okay? Then you have, of course, different effects of stress, which includes family stress, and you also have crises as well, okay, which is also listed on page from 1774 down to 1775, all right, family stress. Now, with regards to, 76, sorry. With regards to family stress, just know that, like it says, the stress that affects an ill person also affects everybody involved, everyone else who's involved in the patient's care. So, for example, let's say there's a family of mother, father, children. Father got sick, okay, is now hospitalized. The illness does not only affect the father who is hospitalized, but it also affects the mom and the children. Okay, so it also has a negative effect on others who are involved in the patient's care or who are close to the client.
You're talking about caregiver burden, right?
Well, family stress was but yes, caregiver burden. The thing with caregiver burden is the stress that it puts on the person who is taking care of the client. Okay, so let's say again using mom, father, children. Father hospitalized. Mom who was the one just taking care of the household, taking care of the children or whatnot. Now she may experience caregiver burden because in addition to taking care of the household and the children, she also has to take care of her sickly husband. She also has to, in addition to taking care of the sickly husband, she also has to make sure she takes care of the finances too. Now she's going to be burnt out, easily burnt out. When we do see this in place, and you as healthcare providers should be looking out for this, you need to, one of the things that you can do is referrals. Provide them with the resources that are available to them either in the community or get in contact with social services or a case manager to see what could be afforded to that mom so that she's not burnt out or she gets some kind of relief, okay? Factors affecting stress and adaptation, again, it depends on the source of stress, the type of stress, and personal factors as well. Again, how the person perceives that threat. Everyone perceives a threat different type of way. So, for example, a person standing right there in the door, all of a sudden in front of the window. Lisa might just see it's just a regular person just standing there, and I just might see it's like something else, like it's a monster or something. Okay? So I'm gonna react differently. Does that make sense? So everyone has their own personal perspective as to the threat or the stressor. Okay? All right. Also, you must know, don't play with me on this one too. Yeah. Different sources of stress. Okay, developmental stress that has to deal with growth, the growing pains. You understand? Growth and development. You go from being a infant to a toddler to a school-age child, and you go through all the different developmental stresses that comes with growing up, basically. Situational stress, again, this is when the stressor occurs because unexpectedly, okay? Illness, traumatic injury, all right? I know it says new job, okay? Oh, does not occur in a predictable pattern. Sometimes new job is predictable. I don't know, okay? Divorce may or may not be predictable, okay? But again, this is situational because this is unexpected stressors, all right? Now, stressful activities that happens in the nursing profession, okay? Yes, nurses do get stressed. You must know some of these stresses. Pretty much self-explanatory, caring for a patient who is dying unexpectedly, experiencing ethical dilemmas that we talked about, or conflict with your peers, caring for a patient who doesn't seem to care when there's a life-threatening prognosis in place, different activities that can cause stress to the nurse, okay? It all depends on the nurse, really, to be honest, okay? Because some nurses, they're like, I did my job, keep it moving, okay? You want to make sure you teach healthy activities of daily living. Of course, when it comes to dealing with stress, exercise in moderation, rest and sleep, of course, eat proper, consume the proper nutrition, have a good support system as much as possible. And of course, you want to manage your stressors differently, like different relaxation techniques. Some people, they find it relaxing to just be alone, be away from it all. Sometimes relaxation could be like going to the beach somewhere or whatnot. Meditation, for example. What also may help is anticipatory guidance. You should be familiar with guided imagery and crisis intervention, which is all discussed on page 1783.
Oh, 83?
Well, mine, guided imagery, anticipatory guidance. All right. This is this is where you're psychologically preparing a person for an unfamiliar or painful event, okay? So you use this patient to teach them about procedures and about what's expected to happen with this procedure. Hence, anticipatory guidance. You're going for surgery. This is a major surgery. It may involve X, Y, and Z. This may be the likely, this is what the care is going to include. So you're anticipating what may happen and you're educating the client on what that is. When the patient is aware and educated about it, it helps promote relaxation. Hence the term anticipatory guidance. Does that make sense? You're teaching them about expectations, okay? While we can't teach them exactly about the surgical, let's say it's for surgery, we can't teach them about the surgery and the medications that are going to be used because we're not the one performing it, but we can tell them, listen, we're going to be doing this, we're going to be giving you fluids, we're going to be administering pain medication when you get out of surgery, we're going to be monitoring your vital signs this amount of time or at this frequency, we're going to be making sure we round on you frequently, etc. That helps promote relaxation and minimize anxiety. All right? With guided imagery, like it says, a person creates a mental image concentrating on the image and becomes less responsive to other stimuli, which includes pain. For example, guided imagery, let me give you an example of when I use this in practice. I had a patient, her blood pressure was steady high. It would not, and she could not be discharged until her blood pressure was below 135 or 85 or something like that. Her blood pressure would stay 160s, 170s, 180s, okay? And all she needed to be discharged, and she wanted to go home, she needed to have her blood pressure lowered. Family was at the bedside and stuff like that. I said, okay, that's what we're going to do. I told the family, be quiet. And I told the patient, close your eyes. What's your favorite place in the world? And she said, it's on the beach away from these people. I said, definitely. I told them, definitely be quiet. Don't make a word. I said, okay, what are you doing on the beach? And she's explaining what she's doing, how she's drinking her favorite drink. She's wearing her favorite hat. She's overlooking the waters. And she's just creating her own imagery. I said, okay, explain this to me. And as she's explaining it, and you could see she's less tense and more relaxed. I immediately took that blood pressure, and it went down to 120. I'll never forget. Once it was in the 120s over 80s. I wrote that thing so fast. I said, keep on imagining, and y'all don't say anything. Discharge. It really does help a lot. Now, does it help in every situation?
No.
Unfortunately, no. But it is a technique that you can use to help promote relaxation, especially when the client is anxious. Okay? So that's guided imagery. And then, of course, you want to use crisis intervention. Again, this is used when there's an immediate threat or crisis, I should say, where there's lack of resources and stuff like that with regards to crisis care. So you want to make sure first thing with crisis, making sure everybody is safe. That's the main thing with the crisis. You have to make sure everybody is safe, okay? Like it says here, crisis standards for care may be considered during times of mass crisis when resources are insufficient. It involves careful consideration of the circumstances and available resources and making sure there's equitable allocations. Again, everybody has what they need, but I know it doesn't stress it in this particular paragraph, but the priority is safety with regards to crisis intervention. Make sure you note that,
It
okay?
says it at the bottom.
Oh, it says it at the bottom?
Yeah, it says promoting safety is an overriding priority in crisis management.
Okay, all right. Oh, I will look that one, okay? Because I know it was in another mid-surg book. All right, boom. Safety. Safety is a priority with regards to crisis intervention, okay? All right, that's basically what I was just talking about. And of course, after in your nursing care plan, you assess, diagnose, plan, implement, and of course, you're going to evaluate. And again, your evaluation is dependent on the individual and the care that you provided. Okay, boom, that is that. What time is it? Damn, 12:20. Okay, 10 minutes. 10 minutes. I wanted to do some questions with y'all, so y'all don't give me no problem tomorrow. Will I have time? Will I not have time? Huh?
So she's already back at the door.
She's back at the door?
Yeah, she just walked out.
Okay, let me just find one hard question and then I'll just give it to her. Sonny boy, she don't play. Everyone has access or no problems accessing the practice questions that I give you guys?
There's another one?
The ones for the last exam were expired, and then I could not access any additional ones.
No, it shouldn't be.
The
It's
ones
on the
that are on
bottom.
Blackboard?
I did.
Y'all looked on the bottom?
I gotta go talk to her.
I did some, but I don't know where.
I did that one that was time limited to 4 minutes, but I could not access another one.
Oh, it's sticker police. Sticker.
Do you have another video on
I do, I'm gonna
Mess with the hallmark.
It is what it is. It's not great with the raccoon.
Would that be the week 4 practice assessment?
Yeah, so you see it, because I put it for the end date of like July or something.
Yeah, I see that now.
Okay, okay, perfect. Okay, let's go to the nursing process real quick. You know, this one question. As tempting as this is, let me skip that.
Tempting.
Yes. All right, Alejandro, let's go. You got 2 minutes.
Want me to read it? You said want me to read it?
Yeah, go ahead.
The home care nurse is visiting a client who is recovering at home after suffering a stroke 2 weeks ago. The client's spouse states that the client has difficulty feeding himself and difficulty with swallowing food and fluids, which would be the initial nursing action. I thought it was gonna be 1. I'm just go with 1.
Why?
Because we don't know if the client's spouse is actually feeding them right. Because she does say that they have difficulty feeding themselves, so she's the one that's giving them the food. And she might be giving them too much, like food or whatever the heck.
I would say 2. Wouldn't that be 2 then?
You should have.
Oh,
That
you're
would
right.
be
Then it's
2.
2. I would say 2 then. 'Cause the
Okay.
client can't even feed himself. Yeah.
And what's the issue?
It's the client's spouse states that the client has difficulty feeding himself.
Client's
Oh,
spouse has
wait.
difficulty feeding himself.
Bro, no.
Okay, yeah, back to 1. We're back to 1. We're back to 1.
Wait. Oh, you're right.
Alejandro, don't play with me.
Michigan.
5, 4, 3. Go.
1. I'm just going with 1.
If this is incorrect, we stay here till 6 p.m.
Yeah.
Ooh.
Yeah.
Good job, Alejandro.
You want to go change your mind and go and imagine things that's not there. Cornelius?
Great. The nurse works in a long-term care facility caring for older clients. The nurse would make which interpretation when an older client complains of pain? Two.
Why?
Because we always trust the patient when they say they're in pain.
Yeah.
We can't feel their pain for them.
Okay, let's see.
Thank you, thank you.
Sakina?
I knew he gonna call me. All right, preoperative client expresses anxiety about the nurse upcoming surgery, which response by the nurse more likely to stimulate further discussion between the client and the nurse. 3.
I agree with that.
Good job. 4 does not address their issues, okay? When it comes to therapeutic communication, choose that issue, that communication that addresses the client's concern. Mason, come on, hurry up. One for the road before
In preparation for
ambulation.
ambulations, the nurse is planning to assist a post-operative client to progress from a lying position to a sitting position. Which nursing action is appropriate to maintain the safety of the client? I think 1.
You think 1? Why?
Because if they're getting dizzy and hypotension when they stand up, they can fall. That can lead to injury.
Anyone disagree with 1 real quick?
Or feel static.
One for sure.
And what's the nursing process? What's the nursing
Always
process?
Protect the patient.
Always.
The nursing process?
My goodness, I don't know that name, I just know what to do.
Did we study perioperative care yet? No. Guys, and the issue, they present the issue, and they ask what is the nurse going to do first, look for an assessment response. But the assessment response has to correspond with the situation. Because let's say they said assess for a gangrenous toenail. You see that? Even though, yes, it does say assess, but the information that you're looking up, it does not correspond with the situation. Does that make sense?
Yes.
Okay. Also, starting next week, we dealing with numbers, lab values. Don't play with me. Know what it means when it's abnormal and know what it means when it's normal. Know the normal signs and symptoms of an abnormal lab value. Since we talked about ESR, what we talked about again? White count, what we talked about again? Something else? I don't know, okay? Don't play with me.